If you are planning to work past age 65, you still have to address your Medicare eligibility. If you're continuing to work beyond the age of 65 and prefer to stay on your employer's group health insurance, you cannot completely ignore your Medicare enrollment obligations. Medicare regulations dictate whether you can remain on your employer's group health plan or if enrolling in Medicare Parts A and/or B is required. It's important to have a clear understanding of the Medicare enrollment requirements and timelines. Possessing this knowledge will help you avoid any interruptions in coverage or any Medicare late enrollment penalties. Let's explore the circumstances when you can postpone enrolling in Medicare when turning 65. The primary determinant of your decision is the size of your employer. If your employer has 20 or more employees, you can remain on your employer plan and delay enrollment into Medicare Parts A and B. You will not be penalized later as long as you enroll in Medicare Part B within 8 months of losing your employer coverage. Alternatively, if your employer has less than 20 employees, Medicare will be considered your primary payer of medical claims, and your enrollment into Medicare Parts A and B should happen during your initial enrollment period. Your initial enrollment period, also referred to as your IEP, is the 7 months that surround your 65th birth month. One scenario where working for a small employer could allow you to delay your Medicare enrollment is if your employer is part of a larger company that collectively totals over 20 employees. If you work for a large employer and can delay your enrollment into Medicare, you should consider enrolling in Medicare Part A only. For 99% of the population, enrolling in Part A is premium-free because you or your spouse worked and paid Social Security taxes. Are there benefits of having Part A and employer health insurance? Yes. For example, if you find yourself hospitalized while enrolled in Part A, it serves as a secondary payer, stepping in after your employer health insurance. This will reduce your out-of-pocket expenses. There is one scenario where you would not want to enroll in Part A when turning 65 or working past 65. Suppose you work for a large employer and are currently enrolled in a high-deductible health plan paired with a health savings account, or HSA. In this scenario, it's advisable not to opt for Part A coverage. The rationale is straightforward. When enrolled in Medicare, you cannot contribute to your HSA account. Should you fund an HSA while on Medicare, you could face taxes, interest, and excess penalties. Can you leave your large group employer plan and enroll in Medicare at 65? Yes. You have the option to enroll in Medicare at any time as long as you've maintained large group employer coverage. To assess the potential benefits of enrolling in Medicare Parts A and B, consider the following factors: the quality and affordability of your employer's coverage, the coverage status of any dependents who are currently covered on your employer group plan, and your long-term retirement plans, the costs associated with Medicare Supplement, Medicare Advantage, and Medicare Part D plans. To make an informed decision, we recommend that you consult with your employer's benefits administrator and a licensed MP Group Medicare insurance agent to provide personalized guidance based on your specific situation. Do you have more questions about Medicare and working past 65? To learn more, you can visit our website, mpgroup.org, or call us at 703-214-4600 to speak with one of our licensed Medicare insurance agents. Know more and stress less with MP Group.